For those of you who don't know what Daxxify is another neurotoxin that's just recently been published into the market and FDA approved. It's actually manufactured here in the United States. The unique thing about Daxxify is it just lasts longer, but also it starts working faster, so you don't have to wait a week. With only 2 Daxxify treatments, you're set for the whole year. So can you frown? So the glabella muscle is a muscle that is right above the eyebrow and within the eyebrow, and it moves the brows towards the center and creates these vertical lines. Frown, relax. So she's recruiting from here. And then so what I do, I kind of pinch the skin a little bit so I don't hit the bone, which is the painful part. And since I've been doing that, my patients have been reported pretty much minimal to no pain. So the forehead is very tricky. It's so individual in every patient, so it's not a cookie cutter. So raise your eyebrows all the way you can. So this is the arch of an eyebrow. So we don't want to depress this arch. So if you look kind of up a little bit, yeah. So this is what you want. You want to have a beautiful arch. I look at where the peak of these lines are, and I try not to go too far to the side of them. I kind of stay medial to it. And that's where I start. And then if you don't want too much brow droop, you kind of stay above the midline of the forehead. Now, another technique is you go deeper into a muscle or you go very superficial. In her, I don't want heaviness. I want to smoothen her skin. I'm gonna do what's called, very superficial treatments. All right, so here's what we're gonna do. So I'm gonna go very superficial. It's almost tangential, and she has very fair skin, so I can see all the veins here. So I'm gonna try not to hit them. One is right where I need to inject, so I'm gonna be very careful. So here I go to the tail of the brow. You can even go medially. The levator muscle is kind of like here in the middle, so you don't want to get too close to the levator, but you have a lot of room here. And in her case, when I go here, the tail, this is when you weaken the orbicularis muscle, which is like a ring muscle. It's like a lens of a camera. As it constricts, it closes, which means it does this, so it pulls the brow down. So we're weakening the muscle so that when she laughs, she doesn't pull the brow down and the brow can relax and go into its natural position. Here I just put my finger on the lateral canthus here and go about 1 centimeter away. She has a tiny vein here, so I go very superficial. And then I just go along where I know she has the crow's feet. Give me a big smile. So she gets them here, so then right here, relax now. Do a little bit also here. Okay, and then I know she gets them all the way here laterally, so I go a little bit laterally. So this is kind of a unique injection technique based on my experience with her. And remember, if you come in to me for the first time, it will take me at least 1 set or maybe 2 sets of injection series for me to learn how you like it, and also for you to give me feedback. So you can't get it always 100% right the first time. So for those of you who jump from provider to provider, keep that in mind, give your provider a chance.